Okay. Okay, so we have talked about all of these slides, right? So have we talked about this process where the amyloblast is moving to the surface, and as it moves to the surface, it deposits a little bit of the enamel in front of itself, right? We said the same thing for the odontoblast, that it was moving backwards towards the dentoblast, but it was putting the matrix on its side. A question for you guys. Does odontoblast secrete dentin directly?
No.
No. What is it making first? Predentin, right? So we talked about it previously as well. What is predentin similar to?
Osteoid.
Perfect, because both of them have a composition which is the collagen type 1. To be more specific, it is the unmineralized collagen type 1, right? So we talked about this particular part. How do you call this?
Odontoplastic process.
Another name for it?
Tom's fiber.
Tom's fiber. How do you call this triangular process of amyloblast? Tom's process, right? So do not confuse them. So Tom's process is sitting in the enamel during its deposition. Odontoblastic process or Tom's fiber is sitting here. Have we talked about this part? There, in addition to the collagen type 1, because this is the organic part of the predentin and dentin, right? You remember that dentin is approximately 70% hydroxyapatite crystals and 20% is organic. To be more specific, the collagen type 1. So in addition to collagen type 1, there are other two organic proteins present in the predentin and dentin. And these organic proteins are going to be known as the dentin phosphoprotein. Sometimes in the self-control test, they say DPP. Okay, they don't give you the whole name, they just say DPP. And dentin sialoprotein, right? So another name, DSP. So remember that your predentin and dentin, in addition to collagen type 1, they also have two more proteins, which are called DPP and DSP. What is their importance? DPP initiates mineralization of predentin. So we have to ask ourselves, why exactly odontoblast is starting to add calcium to the collagen type 1, right? So why is it starting to mineralize the predentin? Because of the DPP. DPP is a regulating protein. It initiates the process. But it is not enough to just start the process. You have to keep it going. Somebody has to constantly stimulate this mineralization, make sure that it continues. This is the function of DSP. Okay, it doesn't start mineralization, it keeps it going. It makes sure that it continues throughout your life. Okay, so you're constantly making predentin and then converting it to dentin. So this is the function of DSP. This is a question in the self-control test. You may see these two proteins there in the past papers. Okay, we talked about this, we talked about this. We're starting from this part. So unfortunately, this self-control test, they will ask you a little bit of the embryology of the tooth. Okay, so what we're going to see right now is happening when you're an embryo. Okay, how exactly do we make the tooth? We even have some slides which are from embryonic rat, from a fetus rat, okay, where we can see how exactly the tooth was made. So you remember this, that amyloblasts were responsible for making enamel. Could you remind me, where do amyloblasts come from?
Ectoderm.
Very good. And you remember why?
Because it's in contact with the outside.
Exactly. You smile, enamel, the most outer part of your tooth is facing outside. Dentin is produced by the odontoblasts, right? And you remember that odontoblasts do not come from any of the germ layers. They come from the neural crest cells. Last semester, embryology, you remember that when you were trying to make a neural tube, right? So this was the neural tube, this was the notochord. The most superficial edge of the neural plate gave rise to the neural crest cells. Before this tube has fused, remember it was supposed to fuse like this, the neural tube. Before it fuses, these neural crest cells are supposed to dissociate. They're supposed to run away and go to the places where they are needed. One of the places is the tooth, right? So neural crest cells are supposed to come to your jaws to give rise to the odontoblast. Okay, unfortunately it had shifted here, but I will show you. The entire tooth development can be divided into 4 stages. The first is called bud stage, cup, bell, and finally tooth primordium. In a way, tooth primordium stage is a ready tooth, because in this stage you will see enamel and dentin. They're already there. So as a result, this tooth is more or less ready. Of course, there are some additional things which must be added, but more or less tooth primordium is ready. Primordium means before birth. So in a way, this tooth is a ready tooth before you're born. But in the bud, cup, and bell stage, there is a very important organ present, which isn't present in the tooth primordium. This organ is called enamel organ. So do you see it shifted? This thing is including tooth primordium. That is not true. Enamel organ is only present in the first 3 stages of the tooth development. And of course, you can understand that what is enamel organ going to be given rise to? Of course, the enamel. So let's take a look. This is a histological representation of the stages, and this is from the book, just a picture-wise, right? You can see that there are a bunch of stages. Unfortunately, the weeks are important for us. So there is something which is called initiation stage. It happens during 6th week of embryological development. So embryo is still in a very, very early stages. Something happens there. So what you can see here, this is a piece of embryo's jaw, right? So you can clearly see this. This is the oral cavity itself, right, inside the mouth. And this is just a little piece of it. Would you find a bone in the 6-week embryo in the jaw? Would the jaw have the bone when the embryo is 6 weeks old? Yes or no?
Isn't it still cartilage at that time?
It's not even cartilage. 6 weeks, it's too early. It's way too early. There's nothing there. There's no bone. There's no cartilage. So what is this? How do you call embryonic connective tissue?
Mesenchyme.
Mesenchyme. So what you see here, this is mesenchyme. So let's imagine, I will show it for you like this. This is jaw, lower jaw of the future fetus, right? So this is still an embryonic stage. You take a little piece of it, and this is what you see here. The entire future mandible is not there yet because this is still very early. This is week 6. Instead, you can see this mesenchyme. This mesenchyme later will become your mandible. How do you call that ossification? Last semester, we have learned that there are 2 types of ossifications. How do you call when mesenchyme becomes bone? Which 2 ossification processes do you know?
Chondral.
Endochondral, this is one, and another? Intramembranous. Okay, so these are the 2 processes of making a bone. One is called endochondral ossification process. One is called intramembranous ossification process. What is the difference between the 2?
Endochondral arises from cartilage.
Very good. Just extra step there. Endochondral ossification can be summarized like this. Mesenchyme becomes cartilage. This cartilage is converted to bone. Which bones arise through endochondral ossification? Give me an example. Come on, Tasnim. I know you want to say something. Say it. It doesn't matter.
Long bones.
Very good. Long bones, irregular bones, basically anything that isn't in your head. Everything down, basically. There are some exceptions, but basically everything from your head down arises through endochondral ossification. So your long bones, your, I don't know, your pelvis, everything. So how could you describe it? So what do all of my bones at the bottom have in common? What do they do?
Weight.
Very good. They bear weight. So any bone that has to bear weight has to arise via endochondral ossification. Where's my mandible? My mandible is on my face. My face only bears the weight of the beauty. So there's no actual weight there. So which process, which ossification process would the face bones come through?
Intramembranous.
Intramembranous. And intramembranous, how exactly it happens? We don't do the cartilage. Mesenchyme directly becomes bone. So all of this mesenchyme that you see here, it will eventually become some kind of bone. Because we're talking about teeth, this mesenchyme is the future mandible or the future maxilla, right? It's one of the two because we're talking about the teeth. But you can kind of see already, is this the future mandible or the future maxilla? And how do you know?
Mandible, because like it's going down.
Very good. So this is the future tooth. And this tooth will be here eventually. But which way will it erupt, right? So how will it come out when it's time? It will come out this way. So all of your lower teeth, when they come out this way, right? So through this tissue here. In embryo, this tissue is called primary epithelial band. But what is another name for it? What do you think this will become?
Gingiva.
Very good. This is the future gum. This is the future gingiva. But from embryological perspective, what is another name for it?
Masticatory mucosa.
That's from histo. Okay, gingiva is masticatory mucosa. We have discussed it for sure, but from embryo part. You remember in embryo, we always have to clarify which germ layer are we looking at, right? So because 3 germ layers give rise to everything. So which germ layer is this?
Ectoderm.
Ectoderm. So your gum, your masticatory mucosa will arise from ectoderm. If you look into the mouth of an embryo, which is 6 weeks old, its entire mouth cavity is lined by ectoderm. And that ectoderm will become whatever we need, right? So the gum, the hard palate, the soft palate, your tongue, etc., etc., etc. So is it understandable more or less what you're looking at here, right? So this is your gum, this is your future bone, right? So I mean future gum, future bone, and you can see that this is the ectoderm. This is the oral cavity right here, this white space, and this is the mesenchyme. So initiation stage is very easy. Basically what you see is that the ectoderm is invaginating into the mesenchyme, right? So it protrudes downwards like this, creating something which is a C-shaped structure called bud. By week 8, you can see that this ectoderm is fully inside the mesenchyme, and it gives rise to this particular bud-like structure. My question to you, how many buds are you expecting? In total, how many buds should there be?
32.
So 32, that's which teeth?
The permanent
The
plus all
permanent.
the
But
all the
don't
milk.
forget, we also have the milk teeth. How many milk teeth do we have?
20.
20. So which teeth do you make first? Milk or permanent?
Milk.
Milk. But eventually you will also have to make permanent teeth. I have a homework for you. Research skull, right? So jaw, skull of the baby, like somebody who is 2-3 months old. It's creepy as hell. They have 2 sets of teeth like that in the maxilla and 2 sets of teeth in the mandible. You see 2 ready sets are there. They haven't erupted yet. Okay, so this is your homework. Research skull of like a 1 or 2 months old baby. So what is the total number of buds are you expecting?
42.
Okay, 20 plus 32, we have 52. Okay, eventually you're expecting 52 buds in the entire oral cavity, right? So because these buds will come out to be teeth. So very good. Let's talk at the first stage. So this is your bud stage. This is a very good picture of a typical bud tooth. Do not forget that there should be 10 in each jaw if you're talking about milk teeth, right? So that's 20. And 32 for the permanent. But eventually you will see that there are 2 of them sitting next to each other, the milk and the permanent tooth bud. So sometime through the development, you will see as many as 52 buds in the oral cavity. So I point and you tell me, what is this?
Ectoderm.
Ectoderm. Another name for ectoderm in here specifically, this is oral cavity epithelium, because this is the oral cavity, right? So that's the space of your mouth. So this is ectoderm or oral cavity epithelium. What is this?
Mesenchyme.
Mesenchyme. What is this? Let's see.
Toothless cartilage.
This is bone. Okay, cartilage may look similar. We will see it on the slide, but this is bone. So what do you see? From 8th week of the development, some of the mesenchyme is already starting to differentiate into bone. So this is the future bone of the mandible, right? How do we call this structure? This is the dental bud. So all of this tissue, this and this and this is ectoderm inside of the mesenchyme, creating this dental bud. What's interesting is the following, that as this bud appears within the mesenchyme, mesenchyme responds. Do you see there are lots of mesenchymal stem cells actively proliferating, right? So they're actively proliferating around the dental bud. So I repeat this information. When the dental bud is inside the mesenchyme, mesenchyme responds by proliferating. There is a very important structure that we have to pinpoint. Unfortunately, in the book, they say that it is here. But in the lectures, they say it is here. Okay, the structure is called dental lamina. So I go back here, this right here, this is known as the dental lamina. What is dental lamina? Well, you can agree with me that this little tiny bud that you see here, this is your future tooth. We're going to make an entire tooth out of this tissue. What is this? This is your oral cavity epithelium. So what is dental lamina? It is just a connection, right? It's just a bridge, a connection between oral cavity epithelium and developing tooth. So as a result, in our university, in the lectures, they put dental lamina here. So I repeat, oral cavity epithelium, aka ectoderm. All of this ectoderm is inside of the mesenchyme, creating a bud-like structure. There is a connection between the bud and the oral cavity epithelium, which is called dental lamina. When the bud is present in the mesenchyme, mesenchyme responds to the bud to the presence of the bud by actively proliferating. It is creating a home for somebody. For who do you think? Who is going to come here soon? Who was detaching and migrating to different places?
Neural crest cells.
Neural crest cells. So all of this mesenchyme, it's proliferating because it is creating an area for odontoblasts. Odontoblasts are going to be arriving to this area very soon. So what is the next stage? We have finished the bud stage. This was approximately 8th week. The next stage is the cup stage. This is approximately 10th week, right? What is the major thing that you see? What is the difference? So this is still your oral cavity epithelium, aka the ectoderm. You can still see the connection between the epithelium and developing tooth called dental lamina. But where is the bud? The bud has modified its appearance. How does the bud becomes cup? You can imagine that this deeper portion of the bud protruded backwards. Okay, it's pushing backwards. Why is it pushing backwards? Because of the proliferating mesenchyme. As it proliferates, it pushes this tissue this way. So if I redraw a bud after this, so it looked like this, the bud. If you push this tissue this way, now it would look like this. Am I right? This tissue has protruded this way. Why did it protrude this way? I repeat, mesenchymal cells. They're right here. They're actively proliferating in this region. A bud has become a cap. Do you see? It's literally like a cap holding some kind of structure. So what do we see? This is your oral cavity epithelium, aka the ectoderm. This is your dental lamina, the connection. The bud has become a cap. Do you see? This part has protruded backwards. What did I tell you? Mesenchymal cells are actively proliferating in this region because they're waiting for the guests. The guests are the neural crest cells, right? So the mix between neural crest cells and mesenchymal cells is called dental papilla. So this region right here, this dental papilla, it consists of two types of cells, mesenchymal cells and neural crest cells. So in the bud stage, you were only waiting for the neural crest cells to come here, right? In the cup stage, they have already arrived. When the neural crest cells have come here, this tissue is now called dental papilla. So is it clear? Mahdi, tell me, what does dental papilla consist of?
Like in adults, it consists of the nerves and some arteries.
You're confusing with the pulp. Repeat the sentence that I just said. What does dental papilla consist of?
Okay, yeah, here it consists of the migrating, what are they called? I forgot the name, to be honest.
Neural crest cells.
Yeah, neural crest cells.
And who else is here?
And mesenchyme.
Mesenchymal cells. Mahdi, a question for you. Does dental bud here have neural crest cells?
No, they still didn't migrate.
Okay, so this is what I want you to understand. In the bud, we do not have them here. It's just mesenchyme. But in the dental papilla, we do have, right? So that's where the neural crest cells are going to be. What's important for you guys to remember is that neural crest cells, we're going to see it this semester a lot. They give rise to many things. And these things are not related whatsoever. Okay, odontoblast comes from neural crest cell. So does a chromaffin cell in the adrenal gland that makes epinephrine. They both come from neural crest cells. So it's very important that if neural crest cell comes here, we can't allow it to leave. We can't allow it to go to other places. So it has to be concentrating because it is inducing so many changes in the bodies, right? As a result, some neural crest cells volunteer to act as a guard, somebody who is going to keep neural crest cells from leaving this region. This guarding is called dental sac. So dental sac is like a border around the dental papilla. It also consists of the neural crest cells also, but these neural crest cells are keeping the rest of the neural crest cells within this region. It doesn't allow them to leave. Unfortunately, you can see that it's very confusing, right? We have neural crest cells in the dental papilla, and we have neural crest cells in the dental sac. To make sure that you aren't confused, or even more confused, neural crest cells have another name. Do you guys remember it from last semester? There is a much older name for them. You're going to see this name in the final oral this semester. Very old name for it. So that's why it confuses lots of people. Neural crest cells are also known as the ectomesenchymal cells. Okay, that's another name for them. Much older, like 50 years ago, they used to call them. So in the self-control test, or even in the oral, what you must say is that dental sac consists of ectomesenchymal cells. But what are you really saying? What you're really saying is that dental sac consists of neural crest cells. The same neural crest cells that are also present in the dental papilla. Does it make sense? A question: do we have ectomesenchymal cells in the dental papilla?
Yes.
You see the logic? You may want to say yes. According to our department, no. According to our department, ectomesenchymal cells are only present in the dental sac, even though it's the same neural crest cell. Okay, it is the same. It's very confusing. They're trying to make it easier for you, but they end up making it more confusing. So you have to make sure that you understand. There is a neural crest cell, a normal neural crest cell. It is sitting in the dental papilla. There's another neural crest cell, which you also call ectomesenchymal cell. And this ectomesenchymal cell is sitting in the dental sac. What you need to understand that even though they are the same, you're gonna see it today that they are not really the same. Because the cell that arises from this neural crest cell is completely different from a cell that arises from this neural crest cell that is sitting in the dental sac. So these cells are related, but they aren't really the same. That's where the ectomesenchymal thing comes in. So I repeat, we have a neural crest cell number 1 sitting in the dental papilla. It gives rise to one type of cell. We have a neural crest cell sitting in the dental sac. It is given to another type of cell, completely different. Because it is given to another type of cell, its other name, it's ectomesenchymal cell. So you cannot say that in the dental papilla, they're ectomesenchymal cells, because that's not where they are. They're in the dental sac. They're giving rise to a particular cell that you're going to see right now. Does it make sense? Let's go cousins.
So we can say that both contain the neural crest cells.
Yes, absolutely. Both contain the neural crest cells, absolutely. But only dental sac has ectomesenchymal cells. You need to remember that dental sac is not a one layer. Actually, it is 2 layers. There is the inner layer and the outer layer. We're going to talk about it today. So remember that. 2 layers in the dental sac, inner and outer. Now, this cup stage starts to have 2 types of epithelium. So that tissue that has protruded backwards, so this one, it starts to be called inner enamel epithelium, this one. So this tissue, which is protruding backwards, above dental papilla. This is known as the inner enamel epithelium. Sometimes in the dentistry, they call it inner dental epithelium. It's the same thing, okay? So inner enamel or inner dental epithelium. The tissue outside, you of course can understand, this is known as the outer enamel epithelium, right? So this one, this is the outer enamel epithelium. Do you see that there is a part where outer continues as the inner, right? So there's a junction point, a reflection point between the two epithelia. So this junction point is known as the cervical loop. I'm going to call it cervical loop. Between outer and inner enamel epithelium, between the two of them, there is lots of connective tissue, lots of loose connective tissue. And this loose connective tissue is known as the stellate reticulum. It's called stellate reticulum because the fibroblasts here, instead of having a normal spindle shape, right? This is a normal shape of a fibroblast. They have a starry shape, okay? So they have this additional little tiny protrusions on the side. So that's why it's called stellate reticulum. The fibroblasts here have additional processes. So I point, you tell me, because it's very important, okay? I go back here. How would you call this?
Outer enamel.
Outer enamel epithelium. This is the continuation of the ectoderm, right? You can see that this is still ectoderm. How do you call this one?
Inner
Inner enamel epithelium. How do you call this connection between them?
Cervical loop.
Cervical loop. How do you call this loose connective tissue between the two enamels epithelium?
Stellate
Stellate reticulum. So if you can see, we have three layers now. We have the outer enamel epithelium, stellate reticulum, and inner enamel epithelium. This is the beginning of enamel organ. So this is the beginning of enamel organ. So this right here is your future enamel organ. Because we're missing one more layer. We're going to see that in the bell stage, right? In the bell stage, there is additional layer on the top of the inner enamel epithelium, which is called stratum intermedium. When this layer appears, you have a complete enamel organ. So enamel organ has 4 layers: inner, outer, stellate reticulum, and stratum intermedium. So a question for you is, it goes like this typically in the self-control test. At which stage enamel organ formation begins, right? It begins approximately at the bud, because we do have that. This is the outer, this is the inner, right? Future outer, future inner. But we start to see the definitive enamel organ in the cup stage, because we can see the outer enamel, the inner enamel, and the stellate reticulum. So the formation of enamel organ begins in the bud stage when ectoderm invaginates into the mesenchyme. But you see the enamel organ at the cup stage when this bud has already created these layers right here. So do I need to explain that enamel organ is ectoderm, or do you understand it? Do you understand that this is the continuation, right? So this is oral cavity epithelium, ectoderm, invading the mesenchyme. This bud right here will become the enamel organ, right? So this tissue just goes backwards and it becomes the enamel organ. What does enamel organ consist of? Outer, inner enamel epithelium and stellate reticulum in between. Are there any questions here? How many layers dental sac has?
2.
Don't forget that because it's important. Now we reach the bell stage. It's approximately week 12. Take a look at this picture. What is the first thing you see is different compared to cup? What you don't see. I'll help you.
Dental papilla.
Dental papilla is here. This is dental papilla.
There is like another side thing.
What you do not see. What do you see here that is not present here? What do you see here?
The mesenchymal cells and the stellate reticulum.
Here's the stellate reticulum, the starry-shaped tissues.
The mesenchymal cells.
Mesenchymal cells are in the dental papilla right here with the neural crest cells. So again, let's see. Let's find the difference, literally. Have you ever done those when you were a child? Find the difference? Very good. What do you see here?
Intermediate.
Dental lamina, I heard it. Dental lamina is present here. It's connecting you to the oral cavity epithelium. On this picture, you cannot see anything. There is no dental lamina. It should have been here like this, connecting you to the oral cavity epithelium. So what is the major thing between the cup stage tooth and the bell stage tooth? Presence of the dental lamina. Do you see it's not there? Bell stage tooth lost the connection to the oral cavity epithelium. It is no longer present there. This is one of the things that will actually help you to identify a bell stage. Okay, always look for the connection to the oral cavity epithelium. If you see dental lamina, this is a cup stage. If you don't see it, this is a bell stage. So if this is where the dental lamina should have been, but it's no longer there, that means that this is the outer enamel epithelium, right? This is the inner enamel epithelium. The loose connective tissue between them, stellate reticulum. But now you notice that in the bell stage, there is additional layer arises, which is called stratum intermedium. It's right on the top of the inner enamel epithelium. In the bell stage, your enamel organ is complete. That's it, it's ready. So this is enamel organ. This 4 layers, right, from the outer to the inner, including stellate and stratum, are all ectoderm. They are deep in your mesenchyme. Do you see? This is the oral cavity epithelium, but your tooth is no longer connected to it to any way. So enamel organ is complete. Guess what enamel organ will give rise to? Very difficult question. What does enamel organ give rise to?
Ameloblasts.
Very good. It should give rise to the enamel. Who gives rise to the enamel? Ameloblast. So one of these 4 layers should eventually become ameloblasts. Which one? The inner enamel epithelium. So at bell stage specifically, bell stage right now, 12th week, inner enamel epithelium differentiates to become ameloblasts. Ameloblasts are very tall columnar cells. That's their appearance on the histo slide. Very tall, like extra columnar cells. So is it clear? Inner enamel epithelium at the bell stage specifically becomes ameloblast. Simultaneously, something is happening to the dental papilla. You remember that dental papilla is a mix of the 2 cells, the mesenchymal cells and the neural crest cells. At the bell stage right now, the neural crest cells migrate to the periphery of the dental papilla, okay? They migrate to the periphery, to the most superficial point of it. Do you see these cells? That's your neural crest cells. They're right on the surface. Guess what they will become?
Odontoblasts.
Odontoblasts. So the neural crest cells on the surface of the dental papilla will differentiate to become odontoblasts. A very typical question in the oral, they will ask you to say, what is the most important thing about the bell stage tooth, right? So like if you have to just in one sentence, what exactly happens in the Bell stage tooth? The answer is we form amyloblasts and odontoblasts. That's the key point, that in the Bell stage tooth, we make the most important cells of the tooth, which is the amyloblasts and odontoblasts. What is the most important thing of the cup stage? We make enamel organ. We're actively making enamel organ. What is the most important thing about the bud stage? Well, I don't need to say it, right? So ectoderm invades the mesenchyme to make sure that a future tooth can develop. So are there any questions about the Bell stage? No. Okay, this is enamel organ. We have talked about it, right? This is a homework for you. Just read about each of the layer of the enamel organ. It's not really important. It's almost never asked. It's just for you. So now let's start tooth primordium. This is the last stage, right? So we say that this is the tooth which is basically ready. If it is basically ready, how do we know that this is a tooth primordium? I told you, look for the products of the previous cells. So in the Bell stage, we only made the players, we only made the cells, amyloblast and odontoblast. In the tooth primordium, their products are ready. So what do you see here? This is your dental papilla. These cells on the surface are odontoblasts. They came from the neural crest cells. Do you see there is a very thin line here, right? Like almost, how do you say it? Like almost pale. What is this? Pale line. Next to odontoblast. What is odontoblast first secreting?
Predentin.
Very good. So this pink line right here, this is predentin that these odontoblasts are secreting. What is on the top of the predentin?
Dentin.
Dentin, of course, that's already the calcified predentin, right? Do you see? Because odontoblasts are moving this way. So the further away from odontoblast you are, the more calcified you will be, because everything which is next to odontoblast is fresh. Fresh is predentin. It's not calcified yet. On the top of the dentin, we have, of course, enamel, right? You can see a little bit that this enamel is also looking very weird. So it could be pre-enamel. This dark line right here could be pre-enamel, because, agree with me, secreting 98% hydroxyapatite crystals, you cannot do this. So of course, first you make organic substance and then add the calcium to it, and until your substance is 98% calcium, right? So like your enamel. And the tall columnar cells on the top, like these ones, these are your amyloblasts. Okay. Okay, so what do we see? We start a very important part, which is the root. Because what you see here, this is the crown, right? You remember, crown, outer enamel, inner dentin. Somewhere at the bottom there, we should make the root. What is the most outer part of the root?
Cementum.
And the most inner?
Part.
Dentin, of course, because don't forget, dentin is present everywhere, right? So in the crown and in the root. So let's take a look. Okay, I will draw it for you because it's easier for me. We're going to talk about how do we make the root. So here you see the outer enamel epithelium. This is the cervical loop. Cervical loop continues as the inner enamel epithelium. What will the inner enamel epithelium become?
Amyloblast.
Amyloblast. So these cells right here are amyloblasts. How do you call this loose connective tissue between them? Between outer enamel epithelium and amyloblast. Stellate reticulum, very good, right? So it has a starry fibroblast. So do you understand where we are, right? So outer enamel epithelium, amyloblast, stellate reticulum. Somewhere here, we have a dental papilla like this, right? So this is a dental papilla, DP. Which cells are on the surface here?
Odontoblasts.
They will become odontoblasts, but at first they were
Neural crest.
neural crest cells,
Yes.
right? So these neural crest cells will eventually become odontoblasts. So this is odontoblasts that were neural crest cells, but will become these cells. Between the amyloblasts, let's put A here, these cells are amyloblasts, these cells are odontoblasts. Between them, this is the area of a crown, right? So this is the place where enamel and dentin will be produced. You remember that, right? That means that somewhere in this region, a root should be made. So the top area is the crown, and this is where the root is going to be made. So what are we going to do? We're going to magnify this area right here. Okay, we're going to redraw this like this. So this is the outer enamel epithelium. Which cells are these?
Amyloblasts.
Amyloblasts. What is this?
Cervical loop.
Cervical loop. Which cells are here?
Neural crest cells.
That will become
Odontoblasts.
odontoblast. So D. What is this tissue called?
Dental papilla.
Dental papilla. Oh, guys, I forgot to ask you. What is here like this? Two layers.
Sac.
Dental sac, very good. So let me draw it for you here. This is the inner layer of the dental sac. And this is the outer layer of the dental sac. So do you understand? Is it clear until this point? We're making a root. To make a root, cervical loop elongates. It starts to protrude downwards like this. So this tissue, the cervical loop, it creates something like this. I go back. Do you see? Here we have it very nicely visible, almost conical in shape. So this is a cervical loop. This is not a cervical loop. So this conical thing has a name. For now, I'm going to call it hers. Okay, so this is called hers. To make sure that you understand the difference, let me go, where can I go? Let me go this way. Do you see? It's not elongating, right? It's very nicely. Here is the outer enamel epithelium, this is the inner, and this is the connection between them. This is a cervical loop. It looks like this. It doesn't have this particular angle, right? So it looks like this, very nice, very circular. The moment it starts to look like this, do you see? It is kind of elongating forward. It's called hers. So what do we see here? We started with a cervical loop. It was normal to look like this. This is a cervical loop. Outer enamel epithelium, inner. But when it starts to push forward, right? It starts to elongate forward, we're going to call it hers. What does hers stand for? Hertwig epithelial root sheath. Hers, okay? Hertwig epithelial root sheath. So could you tell me what is this of the hers? Which layer is this?
Outer.
The outer
Enamel epithelium, very good. And this is the place where which cells could be?
odontoblast.
No?
Amyloblasts.
Amyloblasts, because this is the inner enamel epithelium. This is the part where amyloblast could be. Due to some genetic regulation, they aren't there. So this is the place where amyloblasts stop. They don't move forward. So hers simply consists of the outer enamel epithelium and inner. This inner enamel epithelium, I repeat, does not become ameloblast because of genetic regulation. Okay, you have transcription factors responsible for that. We don't have to know. When the HERS appears here in this region, it forces on the two sides changes. What was this?
The mesenchymal cells.
Say better. This was, what does I stand for?
Dental sac.
Inner layer of the dental sac. When the HERS appears this deep, the inner layer of the dental sac differentiates. It starts to differentiate to become cementoblasts. So when the HERS appears deep, in the deep region of the tooth, the inner layer of the dental sac differentiates to become cementoblast. So CB, cementoblasts are starting to appear out of it. Guess what these cementoblasts are going to do? Of course, they're going to secrete cementum. Let me put it here like this. This tissue right here, this is going to be cementum. Okay, so this is the cementum.
I have a question.
Just a second, Magdi, let me finish it and then we cover it fully. Okay, so this is the cementum. So I repeat, this is HERS. Where did the HERS come from?
Cervical.
Cervical loop. HERS is just invagination of the cervical loop deep down. When this HERS appears at the deeper layer of the tooth, it induces what to become cementoblasts?
Inner layer of dental sac.
Perfect. Inner layer of the dental sac will become cementoblast. So which cells give rise to cementoblasts? How would you answer this question?
Neural crest cells.
But don't forget our department calls them something else. Ectomesenchymal cells. Ectomesenchymal cells give rise to these cementoblasts. These cementoblasts secrete cementum. HERS simultaneously induces the dental papilla to give rise to the odontoblast along its way, right? You can see that odontoblasts are appearing along its way as well. What are these odontoblasts are doing? Of course, they're secreting dentin, predentin, you understand. So this tissue right here, right? So I'm going to put it like this. This is where I'm going to put D. This is dentin. So this is your root. Your root is ready. We started making it, but you can already see the difference. The outer is the cementum. The inner is the dentin. And what is between the two layers? HERS. Do we want HERS to stay there or do we want it to disappear? It's now between cementum and dentin. Should it stay there or should it disappear? Disappear. So once the cementum and dentin of the root are ready, HERS should disappear, it should fully disintegrate. But sometimes it leaves a little tiny remnant, like a little tiny dot you can see on the slide. It's like a remnant. This dot is between cementum and dentin. This dot, a remnant of the HERS, has a name. It is called island or cell rest of molasses. Sorry, there's one S. Molasses. Okay, so islands of molasses. So I repeat, when your root is ready, between cementum and dentin, you can see that there is a remnant. Not always, sometimes there is a remnant of the HERS called islands of molasses. Now, a very important question. The inner layer of the dental sac has become what?
Cementum.
Cementoblast. What do you think the outer layer of the dental sac will become?
Periodontal.
Bravo. become periodontal ligament. Never forget about this ligament. What does this ligament do? It connects the root of the tooth to the bone. Generally speaking, ligaments are connective tissue. They're part of the connective tissue. Connective tissue always comes from the mesoderm. Where does periodontal ligament come from? Ectomesenchymal tissue. Ectomesenchymal tissue are your neural crest cells. This is why Professor Rosa, she loves to talk about this ligament. In reality, it's not a ligament. It's a specialized tissue because it doesn't come from mesoderm. It comes from the ectomesenchymal cell. Sometimes in the oral, she's very moody. It happens to all of us, maybe a bad day. And when you say periodontal ligament, she's like, you know, like she does the sound and she says, this is not a ligament, this is a specialized tissue, you should know this, so now you know, okay? So periodontal ligament technically is not a ligament because of its origin. Unlike other normal connective tissue, it doesn't come from mesoderm, it comes from ectomesenchymal cells. So outer layer of the dental sac becomes PDL, inner layer becomes cementoblast, that makes cementum, right? Then we have hairs here that used to be cervical loop. We have dentine, odontoblast of the dental papilla. You remember we said that inner enamel epithelium will become amyloblast, right? But do you see where the cementoblasts are? That's where cementoblasts are. So it's a little bit weird. Do you see? That's the outer part of the crown. That's the outer part of the root. So what's up? Well, don't forget amyloblasts are moving this way. Eventually, when the tooth is ready, amyloblasts will be aligned with the cementoblasts. It will be at the same level. They start a bit far away from each other, but when the tooth is ready, amyloblasts will be here. All of this will be enamel. All of this tissue will be enamel right here. Okay, let's do it again, but on this slide right here. One by one, you're gonna tell me. So this is your tissue. We started like this. What is this?
Outer
Enamel epithelium.
enamel,
This is
inner
enamel epithelium, which will become
amyloblast.
amyloblast. Put A. What is this?
cervical loop.
Very good. Here we have something like that, which is
DP.
DP, which is the dental papilla, right? Closer to the amyloblast, here we started already having which cells?
Odontoblast.
Autoblast.
Yes. Sometimes Professor Rosa asks you, what induces the formation of odontoblasts? Like, why do they appear on the surface of the dental papilla? Amyloblasts. Amyloblasts arise first. When they arise from the inner enamel epithelium, they secrete growth factors to force the transition of the neural crest cell to become odontoblast. So the reason we see odontoblasts at the top of the dental papilla because of amyloblasts, because they induced their formation, okay? What is here?
Dental sac.
With its two layers. I will draw it like this, right? So it has two layers. This is the inner layer and this is the outer. Okay, let's do it. What happens?
Cementoblast starts secreting cement. No, this fall the hairs is going to start forming.
Exactly. Formation of hairs. This is the first step. How do we form hairs?
From the outer enamel epithelium.
Cervical loop
Uh-huh.
will invaginate forward. Very good. So it will invaginate forward like this, right? So it will push forward now. So there is no more tissue here. Instead, we have something like this. This is your hairs. You remember that hairs stands for Hertwig epithelial root sheath, right? So Hertwig epithelial root sheath. Okay, appearance of the Hertwig simultaneously, guys. I think it's very important word. Simultaneously induces on both sides. this inner sac, inner layer of sac will become
cementoblast.
very good. Cementoblasts. These cementoblasts make,
Cement.
I put C here, right? So this is cementum is here. Simultaneously, hers forces the outer layer of the dental papilla to become
Odontoblast.
odontoblasts that make predentin converted to dentin. Very good. So that's it. Your root is ready, right? This is the cementum outer layer. This is the dentin. What should happen to hers? It should disappear. Sometimes you can see a remnant of hers, which is called
Islands of molasses.
molasses. Very good.
Island, yeah.
Islands of molasses. Outer layer of the dental sac becomes
Periodontal ligament.
yes, periodontal ligament. Is it really a ligament?
No,
Technically not. Technically, it is a specialized connective tissue because it doesn't come from mesoderm, it comes from ectoderm. If you draw something like this on the exam, it will be very helpful for you, especially on the oral exam. Explain that eventually these amyloblasts will go this way, right? So they will go towards the surface. So they will end up at the same layer, at the same level of the cementoblast. Any questions? Mahdi, I'm asking a few
Yeah,
questions.
okay. Can you like just go back to the previous slides? Again, back. Yes, here. Yeah, here. Can you just say like just point with the pointer like how it's going to happen if it's possible?
It's a bit
Yeah.
difficult because dental sac is obstructing me on this picture. Okay, so if you imagine the dental sac is going down like this, it's not a very good picture, but maybe here you can imagine that it's going this way. Okay, so something like this. This is the crown, this is the future root. Odontoblasts appear here, cementoblasts appear here, PDL outside. So this is your root, this is your crown. This inner enamel epithelium, aka amyloblast, will move this way. As they move that way, they secrete enamel in front of them, right? So as they move back to the surface, they secrete enamel in front of them.
Yeah, like one more thing. Is it the same for the milk teeth and for the
Yes,
adult teeth?
same thing. Very good question, except for the milk teeth, the root formation is very limited. Okay, the root is very tiny in the milk teeth compared to the permanent teeth. So in the permanent teeth, we spend more time making root, yeah, than in the milk teeth. Okay, so here we have a face, a coronal section of a face of a rat. This rat is an embryo rat. Fetus, okay, so it wasn't born yet, so we can see some formation of the teeth, right? So you can understand that these are the eyes, nasal septum, the concave myiasis are very nicely visible. This is the heart palate, this is the tongue. You can see that right under the tongue something is developing. What could it be right under the tongue?
Mandible?
No, under. Mandible is here. It's not really under.
Gland?
A gland? Which gland?
Submandibular.
Under the tongue.
Sublingual.
Sublingual salivary gland. Okay, so this is your future sublingual salivary gland. It's still in the process of development, right? You can see that there are lots of hair follicles are formed on the surface because it's a rat covered with hair, right? And you can see that bone is starting to develop. We can clearly see that mesenchyme is turning into a bone. Point of interest for us is, of course, this area, right? So that's where the tooth is being formed. Don't forget, this is your oral cavity. That means that superficial surface is the oral cavity epithelium. So let's magnify. What do we see? This is the tongue, right? sublingual salivary gland. As you can see, it's still developing because these are only ducts. We can only see the ducts are formed. There aren't any acini yet. It's still very early. So what do we see? What is this? Oral cavity itself. So what is this?
Ectoderm.
Ectoderm, another way to say oral cavity epithelium, right? Your future gum. Okay, here maybe not so much as gum, but yeah, okay, so this is your future oral cavity epithelium or ectoderm. Which stage of this tooth is?
Well,
Yeah.
Cup, because you can see that the inner part is everted, right? So it's kind of in the opposite direction as it was. So this I'm gonna highlight and you're gonna tell me what is this? If you know that this is a cup stage, so what is this?
Inner enamel
Inner
epithelium.
enamel epithelium. Very good. What is this?
Outer
Outer enamel epithelium. What is this?
Dental lamina.
Lamina. It is connecting your tooth all the way to the oral cavity epithelium. How do you call this loose connective tissue? Do you see there's lots of white here? What is this loose connective tissue? Stellate reticulum. Very good. Stella, you know a girl's name, it means a star, right? So stella is a star. So stellate reticulum is a starry connective tissue. And what is this on the surface? What do you think it is? Right on the surface of the inner enamel epithelium.
Ameloblasts.
Inner medium.
Stratum intermedium, very good. It's the fourth layer of the enamel organ, stratum intermedium. But at which stage should stratum intermedium appear?
Yeah, stage.
Which stage is this?
Cup stage.
Cup. This is why I love practice, okay? Because first years of your medical school are important, all the way to the third year. They're very important. They give you this basic knowledge. But when you're gonna reach the fourth year, you're gonna understand that majority of the time, what you learn in the book, it's not what you see in the patient. You don't see it whatsoever. So this is why practice is good, okay? Practice is good. It's good to be actively involved in practice. While I'm with you, never do practice in Hungary. You do not learn anything. Try to do it in your home countries. Try to go, I don't know, to a different hospital, not in Debrecen, to any hospital in Hungary. You will learn more than here because language is a barrier, right? To communicate with a patient, you need to speak the language. So this is why you don't learn practice here. So what I'm trying to tell you, in theory, we learned reticulum should be in the bell stage. Sometimes you see it in the cup stage. So it doesn't mean anything. So just because we see reticulum, it doesn't mean that this stage is a bell stage. It doesn't mean that. Okay, this is still looks like a cup. I can still see dental lamina. Just in addition to this, we can also see stratum reticulum. What is this?
Dental papilla.
Dental papilla. And do you see very nicely, there is a border here, which is
Dental.
dental sac. What is this white tissue?
Bone.
No, this is bone. Yes, you can see that this tissue is already differentiated into bone. This is all bone, yeah.
this is the dental papilla.
Dental papilla is this. This is dental papilla.
Is it the DPL
No,
ligament?
no, we haven't made it yet.
Mesenchymal cells.
Mesenchyme, very good. This is mesenchyme. All of this white tissue is mesenchyme. This is also mesenchyme. This mesenchyme will become bone, right? So dental papilla is special because it also has murocar cells there. That's why it has a special name. But all of this white tissue is mesenchyme. Do you see there's a little outgrowth? This, do you see it, right? So right from the dental papilla, there is this thing. They always ask you about it in the oral question and sometimes in the self-control test, okay? They'll pop up a question here. This is not a dental lamina, this is a vestibular lamina. Okay, this is a vestibular lamina. Guess which tooth should arise from vestibular lamina? Which tooth should be here like this?
Incisor.
Permanent. So from the dental lamina, milk tooth, primary, deciduous tooth arises. From the vestibular lamina, permanent, and they should always be next to each other. Unfortunately, on this picture, it looks very weird because it looks like vestibular is coming from the dental. Okay, that's how it looks like. But actually, dental lamina is this. If we're being very, very specific, dental lamina is this. This is vestibular lamina, and this is still your oral cavity epithelium. So both of them are sitting next to each other, okay? So you can imagine something like this, oral cavity epithelium, and you should have something like this. Vestibular lamina, dental lamina. It should look like this in theory. On practice, what do we see? Vestibular lamina comes from the dental lamina, sort of, right? Okay, I point, you tell me, what is one?
Dental,
Dental
Papilla. Two.
dental
Dental
lamina.
lamina.
Dental lamina. Three.
Patella reticulum. Retinac.
Reticulum. Four.
Enamel organ.
No, what is four?
Stratum.
Stratum intermedium.
Intermedium.
This is stratum intermedium. Five.
Outer
Outer enamel epithelium. Six.
and
Inner
Inner enamel epithelium. And let's do it. Seven.
mesenchyme.
Nope.
Wow.
Dental sac.
Dental sac. So this border right here, this is dental sac. We may not necessarily see the two layers, but they are there, right? So this is going to be dental sac. And this, 8.
Mesenchymal cell.
9.
Bone.
This is bone. If I do it like this, from here until here, what is that?
Enamel organ.
Enamel organ, yes. This was for you, Reina. This was the question for you. So enamel organ is all four of them together, right? So this is the enamel organ. Okay, the same when you study yourself, just kind of, point to what is what. By the way, I forgot to say, it's understandable that this is H and E, right? If I don't say the staining, it's always H and E. Like, always assume it is H and E unless said otherwise. Okay, so H and E. The same idea, right? So this is going to be your rat, embryo, H and E. You see the same thing, nasal septum, tongue, sublingual salivary gland. You can see two sets of teeth. This is the upper tooth, this is the lower tooth, right? So upper tooth and lower tooth. So if you see this particular structure, is it an upper tooth or lower tooth?
Upper.
Do you see that it is upside down? Very good. It's maxillary, it's upper, it's upside down. So what is this?
Ectoderm.
Very good. Ectoderm, oral cavity epithelium, future gum. What is this?
Dental lamina.
Very good. Lots of students are having difficulties with upside down thing. They can understand this part, but they cannot see it upside down. You're absolutely right. It's not in the center as it should be. It's a bit to the side, but this is still a connection between the tooth and your oral cavity epithelium. So this is dental lamina. This is your dental lamina right here. From here until here, what is that?
Outer enamel.
Very good. Outer enamel epithelium. White tissue. Stellate reticulum. This.
Stratum intermedium.
Stratum intermedium. Dark cells.
Amyloblast.
The amyloblast.
I can see why you would think so. Okay, I don't think I have magnified version. Okay, let's call them ameloblast. Yes. So this is inner enamel epithelium or ameloblast. Ameloblasts will be very columnar. You will see them. Okay. So if I were you, I wouldn't say these are ameloblasts. I would say they're pre-ameloblasts. They're like the precursor of the ameloblast. It's just soon it's going to become ameloblast, but not yet. You will see ameloblast and it's not how it looks like. So inner enamel epithelium, right? So this is inner enamel epithelium or pre-ameloblast. What is this?
Dental
Dental papilla. You can see that on the superior surface, there are some cells already.
Odontoblast.
Odontoblast.
At
Neural
which-
crest cells.
But you're absolutely right to say they could be neural crest cells. It's just that in the self-control test, they won't waste time with that. So if they point here specifically, it's already odontoblasts. Okay, so they are very nicely differentiated on the superior surface. So these are odontoblasts. Why do they appear there? Who induced their formation here?
The ameloblast.
Ameloblast. So that means that these cells here are pre-ameloblast, about to become ameloblast. They have definitely induced this process right here. Just a second, guys. Okay. So that means that these cells right here, right? So they are going to be the pre-ameloblast, become an ameloblast. They're inducing the formation of the odontoblast. Of course, you can understand that this is your dental sac right here. What is this?
Mesenchyme.
Mesenchyme. What is this?
Bone.
Bone. Do you see that there is a space between odontoblast and ameloblast? So if I point here specifically, what is this?
cementum.
Nope.
Or
If it was cementum, it would have been somewhere here. Because this is crown and this is root, right? Somebody said what?
horse.
Pulp, right? Pulp or no?
No.
What is?
Is it predentine?
Nope.
Will it be formed in the pulp cavity? The dental pulp?
Dental pulp is here. Future dental pulp is here because it's right in the center of the tooth. Guys, huge space between odontoblasts and future ameloblasts.
Predentine.
Nope. In the
Pre-enamel.
cup stage. Agree with me that this is a cup stage, right? It's very early. What did you say, Tasnim?
It's wrong, you know. I said pre-enamel.
Nope. This is an artifact. It is a mistake. When does enamel, all of these things, when do they appear? At the tooth primordium, maybe at the bell stage, but majority of the time at the tooth primordium. This is too early. This is a cup stage. We're just starting to see the odontoblasts. Just now we're starting to see them. So of course this is a space, this is an artifact, this is a mistake. Unfortunately, histologist has pulled the tissue too hard. As a result, it has separated the odontoblasts and ameloblasts. Okay, this is an artifact. It shouldn't be there. Okay, this is for you, right? So you can see clearly the odontoblasts are starting to appear, pre-ameloblast, and this space is a mistake. Take a look, very nicely, it's visible. How do you call this?
Cervical.
Cervical loop. But do you see what is it doing? It's pushing forward. So is this cervical loop?
No.
This is
Horse.
hers. This is the Hertwig epithelial root sheath. So you have started to make root. Okay, in this tooth already the root formation has begun. Now, here staining is going to be very interesting. I'm going to tell you immediately it's not H&E, right? So that's why I ask you, why is it, what's the staining? So this tissue right here is the brain, right? This is the nasal septum part of it. This is the heart palate, tongue. We're going to go to this area right here. And there is additional arrow that is pointing here. Always on the slide, they ask you, what is this? Always. We will learn in embryology, but for now, I want to add it here for you. This is a Meckel's cartilage. In embryo, we will learn what is that when we do embryo. Okay, Meckel's cartilage. This tissue, it's Meckel's cartilage. So whenever you pick the slide, they always take you here. They're gonna be like, what is that? This is a Meckel's cartilage. What does it do? Well, it doesn't give you mandible. That's what it does. It doesn't. It should disappear. So to make a mandible, this cartilage has to disappear. That's what it does. So it's an embryological kind of structure only. We don't have it.
So like you mean it ossifies?
That's what I'm trying to tell you, that it doesn't. So if it ossifies, this is endochondral ossification. In the face, we don't have endochondral ossification. We only have intramembranous. So this cartilage should disappear. The mesenchyme around this cartilage should become mandible. It's a very confusing process, but we'll talk more details about it in embryo. Okay, there you go. Which stage?
Cap.
For sure, this is a cup stage. It looks like a cup for sure, right? So this is your oral cavity epithelium, aka the ectoderm. What is this?
Dental.
Dental lamina. You can understand this is the outer enamel epithelium, inner enamel epithelium, dental papilla, right? It's the same thing which we just talked about. It's not interesting. What's interesting is the slide is this. What is this?
Bone.
How do you know? Because this slide typically appears in the oral question, not in the self-control test. They don't even care about this thing. They immediately take you here, immediately. So how do you know this is bone? Let's refresh our Histo 1.
There is no cells.
I have magnified a little bit for you, right? So this is the outer enamel epithelium. This is the inner, this is the dental papilla, dental lamina, right? And this is the bone itself. Okay, Mahdi have said that there are no cells, right? Quite on the contrary, look how many cells there are. So every little tiny red dot, this is a cell. So how do you know that this is bone and not cartilage? Because it might look like a cartilage, right? It might look like a cartilage. To answer this question, you first have to say about the staining. What is the staining here? It's not H&E. So what is the staining? Sorry?
Azan?
Very good.
No.
This staining is
Yeah.
Azan. Very good. This is Azan staining. But it doesn't have this typical blue thingy, right? So whenever we think about Azan, we immediately imagine this bright blue color. So how do you know this is Azan?
The nucleus in red color and the
Perfect. That's it. You don't even need to say anything else. Every single nucleus, take a look, all of these are cell. Every single nucleus has a red color. Every one of them. Whenever you see a red nucleus, it's Azan. Okay, red nucleus is Azan. So that means that this is the bone tissue, right? This is the bone matrix itself. Do you see that this bone matrix has a little bit of the blue color? It's not very evident. There's like a hint of blue, like a little like light shade blue. So that's another thing that can help you to say this is Azan. Because what stains blue here?
collagen.
Which one?
One.
Very good. This is bone, so collagen type 1 in this bone matrix is given this hint of blue, right? Which cells are here?
Chondroblast.
Nope. In the bone.
Osteoblast.
Nope. Look at where I'm pointing. They're in the bone. Very good example is here. They're in the bone. Which cell is this?
Osteoclast.
Osteocyte. It's in the bone. It is trapped. So this cell right here is the osteocyte. How do we call this white space around it?
Osteoid.
Nope. Osteoid is maybe this. okay, because it's still embryological development. This could be osteoid, this collagen type 1. Maybe it's not mineralized yet. We don't know for sure. This is embryo. We don't know exactly which week
Lacuna?
is this. Lacuna, very good. The white space around the osteocyte is lacuna. This is a flat of your osteocyte. That's the space where it is residing. Now, very nicely visible on the surface of the bone, you can see these cells.
Osteoblast.
Osteoblasts. So don't forget that they are not trapped, right? So these are osteocytes, they're trapped. The cells on the surface, these are osteoblasts. They're actively secreting the bone matrix. And we can even see this cell.
Osteoclast.
Osteoclast. Don't forget that. Where does osteoclast come from? Because these, just a second, these osteoblast and osteocyte, they come from mesenchyme. They have a mesenchyme precursor. This is intramembranous ossification that is happening here right now. But this osteoclast is not going to arise from this mesenchyme. Where does it come from?
Fibroblast?
Nope.
No.
What is another name for osteoclast? Which cell is it?
Macrophage.
Where do macrophages come from?
Monocyte.
Monocytes. Where do monocytes come from? Pre-monoblast. Where does pre-monoblast come from? Hematopoietic stem cell. Where's the hematopoietic stem cell sitting? In the bone marrow. Okay, so they come from blood. Okay, Mahdi have kind of sum it up. Okay, but you're right to say, yes, these cells, osteoclasts, they come from blood. They don't come from mesenchyme, they come from blood. Just don't forget, where does the blood come from? It comes from the bone marrow, right? So this red bone marrow, the hematopoietic stem cells. Last question here. How do you know that this is bone and not cartilage? That's what they ask you. What is the one thing that tells you this is bone and not cartilage?
You know, when I forgot the
Just
name
one
of it.
thing, Mahdi, just tell me one thing. One thing that tells you this is bone. Sorry?
Vascular.
Very good. Blood vessels. This is a blood vessel. This is a blood vessel filled with red blood cells. Filled. Cartilage is avascular. Cartilage will not have these blood vessels, and all of this tissue will be very compact, will be very close to each other, right? But you see that in the bone there are lots of spaces, and these spaces are filled with blood vessels. Very good. Bone is vascular, cartilage is avascular. So if you don't see these blood vessels, you may think maybe it's a cartilage. Okay, maybe. But because you see these blood vessels, cartilage is out of the question. This is not a cartilage, this is a bone. Okay, another thing, we can see them here. 2 teeth here, 2 teeth here. And I really like this tooth because I don't know what's happening with this rat, but its tooth is growing this way. Okay, I don't understand how it's happening. They don't really talk about it. Maybe in animals it kind of goes like that. I don't know. But in a human, it doesn't happen like this. Okay, so this tooth is growing this way right now, both of them. So it's very weird anomaly. Okay, first of all, which stage?
Bell.
Very good. How do you know that this is a bell? First of all, it looks like a bell. Okay, if you look at it, it looks like a bell, literally. But what is the proper way to say? How do you know that this is a bell?
You don't have dental lamina.
Very good. So somewhere here, this is where the oral cavity epithelium would be. Okay, maybe. Okay, so that's the place where it could be. And we don't see it. Instead, we see that it's already bone. Okay, so it's already fully surrounded by a bone. So yeah, if this is the bone, that means that this is the mesenchyme right here. Right, so this is the mesenchyme. What else don't you see? So this is a very difficult question. So let's start from the most inner part. How do you call this?
Dental pulp.
So the proper way to say, like how we used to say, was dental papilla, right? We used to say that this is dental papilla, but Mahdi is right. Here we don't say dental papilla, we say dental pulp. Why? What are these?
Blood vessels.
Current of molasses.
Because you can see blood vessels. The moment blood vessels are present, technically you cannot say dental papilla. You must say dental pulp. Okay, so the moment you see red spaces within the dental papilla, these are blood vessels, you must call it dental pulp. Which cells are here?
Odontoblast.
Odontoblasts. Which cells are here?
Aminoblasts.
Ameloblast.
Amyloblasts. Amyloblasts came from where?
Inner enamel epithelium.
Very good. So you can imagine that somewhere here is which structure?
Cervical pore.
Loop.
Loop.
That means that what should have been here?
Outer enamel epithelium.
Outer
Outer
enamel.
enamel epithelium. Do we see it? No, it's lost. We don't see outer enamel epithelium. So what is this on the surface of amyloblasts?
Animal then.
Sorry?
Pre-animal.
No, it wouldn't be on the surface of it. It will be at the bottom of it because amyloblasts are moving
Yeah,
this way.
true, true.
So what is
Stratum
this?
intermedium.
Stratum intermedium. Very good. Everything which is on the surface of the inner enamel epithelium, aka amyloblasts, is stratum intermedium. What is this?
Stellar reticulum.
Very good. Technically, this is not mesenchyme. I told you this is mesenchyme, right? So all of this white thing is mesenchyme, but technically it isn't. Technically, this is stellate reticulum. Here, this is mesenchyme. Yeah, because it's out of this tissue. But this white space on the surface of the structure is stellate reticulum. Do you understand? Right, so this is stellate reticulum right here. Which staining?
Azan.
Azan. Nuclei are red. Collagen in the bone is blue. Do you see that between odontoblasts and amyloblasts, there is a thin blue line? Am I right? There's a thin blue line. What is this?
Collagen.
Yes, but collagen is there. But what is called, or what do we call this?
Artifact.
Nope.
Animal.
Artifact, it is going to be empty space. What we can see here is a true blue line. This is predentin. Okay, so you can see that it is on the surface of the odontoblast. It has lots of organic component, which is the collagen type 1. This collagen type 1 is nicely stained with the azan. Blue line is very visible, so this is predentin. So this blue line right here, this is your predentin. Yes? Okay, which stage?
Cap.
Are you sure?
Because there is the dental lamina.
Very good. Dental lamina is present. Oral cavity epithelium, ectoderm, dental lamina, outer enamel epithelium, inner enamel epithelium, right? But what is this?
Hairs.
Hairs.
Hairs on both sides. In the cup stage, did we have hairs?
No.
We had simply
Loop.
loop.
Hair, yeah.
We just had loop, that's it. So because hairs is present, which cells are these? Right on the surface of the dental papilla or dental pulp, which cells are these?
Osteoblast.
Odontoblasts. Osteoblasts are in the bone, they're going to be here, right? So odontoblasts. This is a bell stage. So because of hers, because of odontoblasts, this is not a cup stage, this is a bell stage, even though dental lamina is present. So this is what I'm telling you, that theory is a one thing, but practice is a completely different thing. Okay, so just because we see dental lamina, it doesn't mean that this is a Bell stage. We see hers. We see odontoblasts. This is a Bell stage. Very nicely, you can say in the oral, this is late cup, early Bell. Okay, this is a perfect way of describing this stage because it's just kind of transitioning between the cup and the bell. It's already getting odontoblasts and hers, but it is still didn't lose the dental lamina. So it is early bell, late cup stage. Okay, the same for you, right? So one, quickly.
Dental papilla,
What is this?
blood vessels or dental pulp.
Dental pulp. Okay, this is a dental pulp. 2,
Dental lamina.
3,
Bone,
bone. Okay, 3A,
mesenchyme,
mesenchyme. That still did not become the bone. It will become the bone very soon. Okay, 3B, I apologize, but I have to. 3B,
ectoderm,
ectoderm or oral cavity epithelium. It's still here. Okay, 4.
Inner enamel epithelium.
I would agree with you 300%, but I want you to see. Do you see the cells are here very columnar?
Ameloblast.
Yes, they're unfortunately a bit packed together due to preparation technique, but you can still see that there are lots of tall columnar cells. So these tall columnar cells are ameloblasts. So if I were you, I would say that 4 is the ameloblast for sure. 5,
odontoblast,
odontoblast, 6,
predentine,
predentine. This blue line between them is the predentine. Staining is
azan,
azan. What is this structure here? On the side, this one.
Tongue.
Gland.
Very good. What are these?
Specialized mucosa.
Protrusions. How do we call them?
papilla,
No.
Take a look at them. They're like this.
Felil.
Filiform. Very good. So
More.
these are the filiform papilla. They're very conical. A rat is an animal. Animals have lots of filiform papillas on their surface. Okay, here it is more or less your typical azan. Very nice blue color is visible. Okay, so let's take a look. So first thing first, what is this stage here? And be careful because you can see these things.
Primordial.
See these things? Tooth primordium. Let's do it. What is the center here?
dental pulp,
Dental pulp. Tall columnar cells on the surface.
Ameloblasts.
That's why I said tall columnar cells on the surface to see if you automatically think ameloblast. But take a look. This is a dental papilla. So tall columnar cells on the surface of the dental papilla are called odontoblast. So never confuse. So just because it is a tall columnar cell on the surface, it doesn't mean that it is ameloblast. You have to see where are they, right? So if they're on the surface of the dental papilla, these are for sure odontoblasts. So these ones right here are odontoblasts. Okay, very blue line.
Then that's the enema.
No, on the surface of odontoblast, very blue line is
Pre-enema.
predentine,
predentine. On the surface of the odontoblast, very blue line is predentine. Then this blue,
Dentine.
dentine. What is red?
Enamel.
Enamel. And then you see tall columnar cells here.
Amelo.
Ameloblast. This white space is not an artifact. So from now on, this is not an artifact. This place used to be occupied by enamel. Enamel used to be here, all of it. Enamel is 98% hydroxyapatite crystals. It's the hardest substance in your body. Is it easy to cut through it to make a slide?
no,
Nope. So to prepare a slide, we have to demineralize the tissue. Remind me from Histo 1, what do we use to demineralize the slide? Remember bone. What did we use to demineralize? Every movie ever, if you want to get rid of the body, what do you do?
Wouldn't it?
Put it in acid. Okay, break it, chop it, and put it into acid. Acid will get rid of it. Demineralization is happening with the effect of acid. Free acids, number 1, hydrochloric. Number 2, acetic. Number 3, boric. 3 of these acids can be used for demineralization. If it demineralizes the tissue, majority of the time, we will not see enamel. It's lost 98%, its minerals. We will not see it. We're lucky to see this red tissue right here, that this is enamel. Okay, so we're lucky. Majority of the time, on the surface of the dentine, you will see white space. This white space used to be occupied by enamel, but that enamel was lost. Is it clear? You said that this is dentine. It's blue. You follow dentine, follow, this is still dentine, but now this is a root region. And you can see that this dentine is becoming red. Could you tell me why? Why is this dentine blue, but this dentine is red? It's the same dentine. The only difference that this is in the crown, this is in the root.
Because there is collagen fibers, which is
Where?
collagen fiber 1, so that it
Where?
can.
In the blue or in the red?
No, in the red.
Periodontal ligament.
Just a second, guys. You're confusing it. We're talking about dentine. This is dentine right here. Dentine in the crown is blue. Dentine in the root is red. What is the staining of the slide?
Azam.
Azan. If you see a blue color, what does it tell you?
Collagen is stained.
Collagen is there. So Mahdi is right. You're right to say it's about collagen. But why would it be in the red? Collagen is not red in the Azan. Collagen is blue. So what I'm trying to tell you is that the difference in color is in the amount of collagen, or in our way of saying, in the amount of inorganic tissue, right? So this dentine is blue because it has more collagen, less minerals. This dentine is red because it has less collagen, more minerals. Look at your enamel, it is purely red because it has no collagen whatsoever. It's mostly minerals, right? So it's inorganic tissue.
I have a question, but then how can you differentiate between a nucleus and the red color?
Sorry?
Isn't also nucleus stained in red?
Question, but of course you can differentiate because the cell is a cell. Here we have a like dominant red color. You will be able to say that this is enamel, this is the cell. Okay, so for sure we will like also your background theory. That's why theory is important. We remember from theory that on the surface of the dental pulp there are cells. There's no enamel. There can be enamel here. So of course it's red because of the nucleus. Okay, you have said that this is dentine here. This dentine is red because it has lots and lots of minerals, less of the collagen. Outside of the dentine, this tissue, this is your periodontal ligament. It's already present in the tooth primordium stage, all of this. I'm trying to highlight it for you. This is the periodontal ligament. Unfortunately, I don't have a slide of magnified view of it. I will do it next class, which is tomorrow. Okay, so for tomorrow, I will show you the magnified version of this area, okay, where you will see periodontal ligament, you will see your dentine and the bone outside of it. Okay, so this is a periodontal ligament. It's very blue because it has lots of collagen type 1. The same idea, but take a look. There's no enamel. There's like a little bit is present here, just a bit, right? This is not an artifact. If they point here and say this is artifact, it's not an artifact. Artifact means a mistake, something that isn't supposed to be there. This is supposed to be here because that's used to be occupied by enamel, but no longer is because of demineralization. Okay, same idea. We go here. What is the stage?
Also primordial.
Very good, because you can see this. What is this?
Enamel.
Enamel. What is this?
Dentine.
Dentine. Very good. Bright blue line.
Dentine.
Dentine.
Pre-dentine. Do you understand why pre-dentine is blue?
Yes.
It's purely collagen. There's
And
no.
what is the white color between the dentin and the pulp? And the
Sorry?
pulp?
Which white color? This white color?
Yeah.
Artifact. Okay, this is an artifact because in theory you remember that there shouldn't be any space between predentine and odontoblast, right? So this is for sure artifact. Staining is of course azan, right? Because collagen is visible. Dental pulp with the empty blood vessels. Which cells are these?
Odontoblast,
Odontoblast. Which cells are these?
ameroblast,
Ameroblast. What is this connective tissue?
Design.
Reticulum. Because on the surface of it, this is the stellate reticulum. This is the outer enamel epithelium. We're lucky to see it. Oral cavity epithelium. And what is this?
dental lamina,
The lamina. Is it a cup stage or is it a tooth primordium?
Tooth
tooth
primordium.
primordium,
It really does not matter that we see dental lamina. Here we can see enamel dentine. This is the tooth primordium. Here you can see the bone, right? Here you can see the crown. What is this tissue between them? Periodontal ligament. Okay, so it's still there. So this is a periodontal ligament. Okay,
Isn't it supposed to be blue?
sorry?
Isn't it supposed to stain blue?
It's supposed to be blue, yes, but as you can see, it isn't. So this tissue, this slide is very stretched out. So you can actually see the spaces in the periodontal ligament. So if it was more nicely prepared, it will be as blue. Do you see there are lots of gaps here? These gaps shouldn't be there. So it's very, very stretched out.
What
Like-
about cementum? Can we see cementum?
Very good question. So we're gonna go here. Now, bone. What is this?
The ligament.
Ligament.
Periodontal ligament, very good. Again, it's my fault. I should have magnified this region. Next class, I will for sure. Do you see there are dots here? Do you see them? They're very hardly visible, but trust me, there are dots here. What could these dots be?
Cementoblasts.
Very good. These are cementoblasts. I will magnify in next class to make it very visible for you guys. So these are cementoblasts. Do you see right next to cementoblast, there is a blue line. Do you see this? This blue line. What could it be?
Cementum then?
Cementum. So right next to the cementoblast, this blue line is cementum. I go on the other side. Bone, periodontal ligament. You can see cells here very nicely. And you can see a blue line. What is this blue line? Cementum. This is dentine. Sharp blue line is. What is this sharp blue line? You can see it here as well. Sharp blue. Pre-dentine. The cells here.
Odontoblast.
Odontoblasts. Very good. Next class, I will magnify this area. Okay, the same idea, guys. I cannot do it again and again. It's just lots of slides to show the same things, right? So this is just H and E now. This is not azam. This is hematoxylin and eosin. The same idea: odontoblast, dental pulp, dark line, predentine, white space artifact, right? So there's an artifact between odontoblast and predentine, dentine, PDL. Look how many cells there are. Do you see? Within the PDL, there are lots and lots of cells near to the dentine. So these cells are cementoblasts. Okay, so these cells right here, they are cementoblasts. Last slide for today. We have a very special technique of preparing a tooth. We take a tooth, we grind it with the sandpaper. Do you guys know what is sandpaper? It's used for the woodworks to make sure that the wood is very smooth, right? So the same idea is here. You take a sandpaper and you rub it on the surface of the tooth to kind of break the outer enamel, right? To break it, to make it more permeable. And you stain it with fuchsin. You just add the dye on the surface and you see something like this. So this is right here is your enamel, and this is right here is your dentine. Fuchsia, maybe you have ever heard this word, fuchsia color. It's this. That's the color of the fuchsia. So fuchsin stains like this, but it's not important. What are those lines in the dentine?
Dental tubules.
Very good. So every single black line that you can see here, this is a dental tubule. But we're not interested in that. We're interested in the enamel. Within the enamel, you will see three things on this slide. There is something called enamel tuft, enamel lamella, and enamel spindle. This is your enamel. This is your dentine. Enamel tufts are kind of blackish areas next to the dentine. The reason that they're black is because they're hypomineralized. So this is a naturally occurring thing without our enamel. We can see some areas closer to the dentine, right, where there is less minerals than we would want. Lamella is an actual crack within the enamel, right? So sometimes you open a beer with your tooth, okay, and you break the tooth completely, so you will see that it's going to be a crack through the entire enamel. So this crack, as you can see, is also black in color. Why? Because it is also hypomineralized. It is a defect in the enamel. Spindle, however, is not a defect. This is a normal thing. You can see it here. It's also closer to the dentine. It's like a black line, but this is not a hypomineralized black line. Enamel spindle is a trapped odontoblastic process. You remember that ameloblast and odontoblast started together, right? But then they were going in the opposite directions like that. Sometimes odontoblast gets too close to the ameloblast. So ameloblast deposits the enamel right on the surface of the food process of odontoblast. So its food process is trapped. We can see it in the enamel. Immediately, if we look at the slide, I will show you where the enamel spindles are, where the trapped odontoplastic processes. Always they're going to take you. This is one. Do you see? It's very nicely visible black line. This black line is not a hypomineralized area. This is a trapped odontoblastic process. And here we have two more. Okay, so these are also enamel spindles. What do you think this is?
Lamella.
Lamella, very good. Yes, this is another one, another lamella. And what are those blackish areas closer to the dentine? Tuft, right? So these are the tufts. Tuft and lamella are black because they're hypomineralized. Enamel spindle is black because it is a tissue. It is odontoblastic process, so it's not really hypomineralized.
I have a question. What is hypomineralized?
It means it has little minerals. So hyper means a lot, hypertension. Hypo means little, hypotension, right? So low blood pressure. So hypo means little. Hypomineralized means it has almost no minerals there. Tell me, what are these lines?
Lines of lettuce.
Retzius, very good. So these are the lines of Retzius. And last question for today. You can see that this is the surface of the enamel. This is more of an oral question, not a self-control test question. Why is the surface of the enamel so black?
Eating, stains, lots of cracks.
We just said it is black, tuft is black, it's hypomineralized. Lamella is black, it's hypomineralized. So the surface of the enamel is black because it is hypomineralized. Why? I'll help you. Is it a normal thing?
No,
No, this is not a normal thing. This hypomineralized? No, it's not a normal thing. So why is it black?
because we eat.
Nope.
Smoking.
Nope. I told you how we prepare the slide.
Oh, so
Sandpaper.
use acid.
Exactly, sandpaper. Sandpaper. Here specifically, we use the sandpaper. This is huge abrasion on the surface of the tooth. Smoking could lead for sure, maybe in 25 years. Okay, eating 25 years. This much hypomineralization like that, it's definitely you did something like with a sandpaper. Okay, so the reason it's so black, hypomineralized because of the sandpaper. Okay, that is it. We have finished this huge PowerPoint. Okay, so I will add the other